Hi, folks. It's Marvin Music with MedicareSchool.com, and we want to welcome you to tonight's event. We're glad that you've set aside this time to be with us, and we trust it'll be very helpful, a good learning experience for you. I want to just lay down a couple of items here to make sure you know what we're going to do this evening. I am going to look at a topic for about 5 to 10 minutes or so that has to do with some of the regrets that people have after they sign up for Medicare. And so we'll be discussing those, sharing those with you. And then while I'm doing that, please feel free to start putting your questions in the chat. I'll respond to those as long as I can go tonight, probably about an hour and a half or so. So if you have any questions about Medicare, insurance, A and B, Social Security, those kinds of things, I can answer any of those tonight. So you can put those in. Our producer Daniel will be giving me the questions, so we'll try to get to really as many of these as we can. We always appreciate it when you make sure that we can understand your question. Sometimes you're trying to be brief just to be probably polite and not ramble on, but don't be so brief where I cannot figure out your question. So I'd appreciate that very much. And then two things, well, actually three things. Number one, there will always be this evening a number scrolling at the bottom of your screen. Our company is called MedicareSchool.com. We begin our relationships with our clients always with education. It's been the way we've done business since 2009. 16 years now. And so we believe that people need to understand what they're doing before they make any Medicare decisions because sometimes consequences come with bad decisions that cannot be reversed. And that's very unfortunate when that happens. So we want folks to understand. So we have built a YouTube channel. I think we have a little over 400 videos now that are available for your learning. From all kinds of topics about Medicare and Social Security. So take advantage of that resource. We'd love for you to subscribe to our channel. There's no cost, of course, but the advantage is every time we put a new video out, which is at least one and sometimes two every single week, you're notified so you can stay really up to date on what's going on with Medicare. So we'd love for you to be a part of that. And then our Facebook group as well, that continues to grow. And thanks for all of you that joined that. We have experts that add content to that and answer questions, but also there's people within the group that answer questions well, and it's really nice to hear from people. So this is just a place for you to be able to learn more about Medicare. And then lastly, if you need immediate help, you'll see the 800 number. Our office is located right outside of Kansas City, Missouri, in a suburb called Overland Park, Kansas, right in the Midwest here. And our office is open 7 to 7 Central Time, Monday to Thursday, and then Friday 7 to 6. And so if you need some immediate assistance, you want to call in, we have a switchboard that would take your call and direct you to the right department. We have agents really that are standing by that I have trained personally that can help you really with any question that you have if we don't get to you tonight. So just call in and avail yourselves of that. Just remember this, folks. Anytime you work with a Medicare agent, whether it's us or anyone, you never have to pay the agent. We are compensated actually by the insurance companies, not by you. I've never sent a bill to a client because they don't pay us. It's insurance companies that do. So when you use an agent or use a broker, the insurance companies actually set the premium. So there's no difference in premium regardless of who you go with. The difference, I think, would be in service and knowledge and how they can really help you in your Medicare journey. But the point is there's no cost to you at all to use our services, really any agent or broker throughout the country. We do write in all 50 states, so we can help you anywhere in the country as well as D.C. Okay, so I just wanted to kind of lay that out for you so you're aware of what we can do for you. Tonight I want to talk about this issue here of these three biggest regrets. Now, there are more regrets than these, but we decided we're going to really hit on three, and it really has to do with people that who have made the decision to go ahead and sign up for Medicare. And so the first one I want to mention is just when people make the decision to sign up for Medicare A only. All right, so most of you know Medicare has actually four parts, A, B, C, and D. A is inpatient, hospital services, B is outpatient, and doctor services. C would be called Advantage plans, and D would be drug plans. And so what I'm referring to here with this one is someone who has made the decision that they are going to continue to work or their spouse is going to continue to work. And they realize they don't have to sign up for Medicare B, but they've been told that they have to sign up for Medicare A. And many, many times people enroll into A because they're concerned because someone said if you don't take A, even if you don't take B and you continue to work, you could be penalized. And folks, that's absolutely not true. And the mistake here is for people that do go ahead and sign up for Medicare A only. And again, why? Because they have a good group plan, so they don't take B, but they take A only, and they happen to be contributing to what is called a health savings account. The acronym is HSA. Health savings accounts. These are not flexible spending accounts. They're not health reimbursement arrangements. Those are a whole different rules. I mean just health savings accounts. And so what happens if you do enroll into A only and you have an HSA, you can no longer contribute new money to the HSA. Now, all the money that's in your HSA is yours, certainly to be used for qualifying medical expenses, but you can put no new money in. And so the reason that people regret this is because if they're still working or their spouse is still working and they're covered by an employer-provided plan that has 20 employees or more on the payroll, that is considered to be a large group by Medicare. And so when you do enroll into A only, Medicare Part A goes to the second payer position. Again, 20 or more in the group on the payroll, Medicare goes to second payer position, and your company plan continues to pay first. And so if you enroll into A only, Medicare is going to the second position, your company plan pays first. And so if you have the option to enroll into an HSA, in my opinion, you just shot yourself in the foot, because Medicare in the second payer position may pay, but usually not very well. And so my point is, if I were you and I have an HSA, I wouldn't do A and I wouldn't do B. I would do either one of those. Keep contributing to your HSA. This year, we can max contributions $4,300 for individual plan and $8,550 for a family plan. In addition to that, if you're 55 or above, and you probably would be if you're even looking at this program tonight, you can put an additional $1,000 in that's called catch-up. And so again, I wouldn't do A, I wouldn't do B if I have an HSA. Just keep contributing to the HSA. If it were me, I would max that thing out if you can afford to do so, because HSAs are like healthcare IRAs. The money goes in, it's all pre-tax money. It's tax deductible. You don't pay taxes on it. And if you use that money for qualifying medical expenses, it's never taxed. And if it's a growth account, if it's growing in some fashion, then the growth is also tax deferred. And so I love HSAs. And so if you have one, don't do A, don't do B. And I promise you, as long as you have paid into the Medicare tax system for at least 40 quarters, there will never be a penalty for you. Meaning as long as you work 10 years, paid in that tax system, Medicare A will be a zero premium for the rest of your life, regardless of when you take it. So don't take it thinking you'll be penalized, because that's not true. Only 1% of the Medicare population is ever penalized on Part A, and that's those who actually have to buy it. If you have to buy it and pay a premium, then you could be penalized at 65 or when you retire. But if it's going to be a zero premium, you'll never be penalized. So again, contribute to that HSA, do nothing with A and do nothing with B. You can always pick up that at a later date. Now, before I go to number 2, I want to mention something. If you don't have an HSA, and you or your spouse are going to continue to work, I think it's fine to enroll into A only. In fact, I would recommend it. Number one, there's no cost for you. It is going to go to the second payer position. It will not pay co-pays. It will not pay deductibles if you're hospitalized, but it may pay co-insurance. So when the bill comes through and you're with a large group, 20 or more employees on the payroll, and Medicare coordinates that benefit to see what they'll pay, they will pay co-insurance. And so if you have some co-insurance responsibility for a hospitalization, some people do, then Medicare may pay something. So I like Medicare A only as long as you don't have an HSA. All right, so that's mistake number 1. Mistake number 2 would be people that enroll into A and B, and again, they're covered by a large employer plan. No, not only do they enroll in A, but they also take B. And we see this happen all the time. When people are approaching 65, their spouse are working, the employer-provided plan payroll size is 20 or more, so it's a large group, but they're not sure what to do. They get confused. They're fearful they're going to make some kind of mistake, and so they go ahead and enroll into Medicare A and B. I just helped a guy just in the last couple of weeks who did that. Got some bad advice actually from an agent. And enrolled into A and B. He worked for a large hospital group, didn't have to do anything with A or B, but he enrolled in both of those. And so the problem with that is because it's a large group, again, A and B is going to pay second. His company plan still paid first. So his A was not the big issue because he didn't have an HSA. The big issue was he had Medicare B, which always has a premium. And so if you enroll into A and B when you're covered by a large group, you're just paying this year at least $185 a month for your Medicare B. Some of you, if you're high income, you're going to pay more than that. So my point is, if you have a good group plan that you're covered by, or maybe it could be your spouse's coverage, if you have a good group plan that you like the premium, it's affordable, meaning usually $250 a month or less, then stay on that plan. You don't have to do A or you don't have to do B. It's a mistake to do that. Now, we also see this mistake of having A and B when we're covered by a large group plan when someone is on Social Security. Because when you're on Social Security, you're automatically enrolled into Medicare A and B. Your Medicare card shows up in the mail about 100 days prior to your birth month. And so what is today's the 19th. And so many of you right now that are on Social Security are getting your Medicare card. So April, May, June, anyone turning 65 in July that is on Social Security, your Medicare card is showing up any day now. That card's coming in the mail. It just happens that way. If you are turning 65 in June, you would have gotten the card towards the end of February. And so my point is, when people are already on Social Security, whether that's retirement benefit, spousal benefit, survivor, widower benefit, you are going to be automatically enrolled into Medicare A and B. So your Medicare card is going to show up. But if you're covered by a large group plan, 20 or more employees on the payroll, and it's a good plan, you do not have to stay enrolled in Medicare B. And people who do regret it. It's a waste of money. So what you can do is one of two things to disenroll from B. And that is you can mail your original Medicare card back in. On the back of the card, they give you the opportunity to sign saying, I do not want medical insurance, which is Part B. Check the box, I don't want Part B. Mail the card back in. They'll send you back a new card that'll say Medicare A only, and you can pick up B at a later date. And so many people who enroll in A and B when they're covered by large group plans regret that. It's truly a waste of money. So you don't want to do that. All right, so that's mistake number 2. Now, folks, let me clarify before I go to mistake number 3. There are some of you that must start Medicare at 65. You have to. And if you don't, you're making a mistake. And that's anyone that's no longer working, anyone that is covered by COBRA insurance, TRICARE for life, retired military, you're on an ACA plan, Affordable Care Act plan, or you are, so it'd be anyone no longer working, TRICARE, COBRA insurance, small groups of 19 or less, and ACA plans. That's the 5 groups of people that must start Medicare at 65. You have to, and if you don't, you've made a mistake. But if you're covered by a large group plan, 20 or more on the payroll, you don't have to do anything with Medicare. You don't have to do A if you have an HSA. I wouldn't, and you don't have to have A or B if you have a good group plan. Just wait until you retire and pick up Medicare. All right, that brings us into the third mistake, and this is probably the one that is, well, they're all serious, but this one is not only serious, but just really sad. And that's this, and I'll start taking questions. In every state in the country, all 50 states and D.C., there is a federal law that all states have to enforce upon the insurance carriers that offer supplemental plans in those states. And it is this. We call it the Medigap OEP. Medicare supplemental plans are also called Medigap. The OEP stands for Open Enrollment Period. And in every state in the country, we have this 6-month window where if you want a Medicare supplemental plan, any plan you want, based upon your age, any company that's offering those plans in your state, you can have that MedSup plan with no underwriting at all. The insurance companies have to accept you. They have to approve you. They must cover all your pre-existing conditions. They cannot ask you any health questions. They cannot check your medications. And then they cannot charge you extra premium even if you do have health problems. Okay? And this period of time is called the Medigap OEP. But the issue is it's a limited period of time, and a period of time is 6 months of your Medicare B date. 6 months of the B date. So let's say my B date was coming up April 1 of 2025. Now, from a practical standpoint, I actually can apply for a MedSup plan 3 to 6 months in advance. Most people do it that way. Okay, 6 months, 3 to 6 months of your B date. Most people want to set all this up in advance, and that's fine to do so. But that supplemental plan will go into effect on your B date. So if I signed up for a supplemental plan now, that plan would be 4/1/2025 when my B kicks in and my supplemental plan kicks in at the same time. But let's say that I didn't know about the rule or I procrastinated or whatever. I still have not lost my Medigap OEP because it's now going to go for an additional 6 months of my B date. So that means in my example, starting Medicare 4/1/2025, I would have all of April, May, June, July, August, and September, all the way to September 30th. So from April 1 to September 30th, I'm still in that Medigap OEP. So I can apply for, again, any Medigap policy I want according to my age, any company I want, and they will approve the policy. But after that 6-month window is over, so again, April, May, June, July, August, September. So after October 1, if I ever were to get a Medigap policy, that open enrollment window is over. And in most states now, in order for me to get a Medicare supplemental plan for the first time, now I'm going to have to medically qualify. We're going to have to ask you about 35 health questions, check your meds, get that information to the insurance company, and if they don't like what they see in your medical records or medications you're taking, they flat can deny you. They don't have to accept you. They must during 6 months of the B date, but they don't have to after that. A couple exceptions, New York, Connecticut, Vermont, they still would have to, but the other states, they're not required to do that. All right, and so you don't want to miss that opportunity. That's a huge mistake that we see people make. And so I want to clarify something for those of you that do decide you're going to do A only or nothing, and you're going to work for 2 more years, and then you enroll into Medicare. You're not going to miss that Medigap OEP because you're going to start your B when you retire. So let's say I have A only right now, and I start 4/1/2025, and I work for 2 more years. And I pick up my B date then, and I have a 4/1/2027 date. That's when my Medigap OEP is going to begin. It's 6 months of my B date, whether that's now or 2 years later or 5 years later, whenever I retire. So again, don't worry about missing that. If you're going to continue to work and covered by the group plan, you can still come in, and we call that an SEP enrollment. So you have not lost that opportunity. We only lost it once the B has begun. All right. And so if you have health problems, this could be truly your once and only opportunity in your life to be able to get a Medigap policy with no underwriting. It absolutely will be guaranteed to be approved. All right, so those are the 3 big mistakes. If you want some other further clarification on any of those, you can put those in the chat tonight. All right, okay, Daniel, let's get started with questions. All right, Cheryl, I followed your suggestion when I first applied for Medicare. I'm on 3 insulins and 3 inhalers and was broke by March trying to pay for all of those meds. Okay, first off, Cheryl, a couple things. Number one, I don't know what kind of insulin you're taking, but all insulin copays this year and last year were capped at $35 a piece. Okay, even if you get it through an insulin pump and move it through the Part B system, they're capped at $35. So maybe you took some kind of insulin that was not in formulary. I don't know what you're taking. Okay, but the majority of them today are capped at $35. Okay, so we're March now, so I don't know how many you take. You say 3, so that'd be $105 a month for 3 months. So that's only $315 that you should have had to pay. There's no deductibles that apply to insulin. It's just a flat copay, $35. Now with your inhalers, I feel for you in that regard because inhalers can be expensive, especially if you have COPD. If you're on 3 of them, you probably do. Okay, so here's the issue with that though. Even though it may be painful, Cheryl, the deductible this year on inhalers, a lot of them, is once a year, $590. $590, so you probably had to meet that. And then I don't know what drug plan you're on, but the most you would have paid for those inhalers after you met your $590 deductible would have been 25% coinsurance. So if that inhaler costs, let's say $400, you should have had a copay of $100. All right, so my point is, as far as being broke, the insulin at most was $105 a month, so that's $315. You may have had to meet your $590 deductible. That could have happened. So now let's just call it 6, and now we're at 3, so we're up $900, and then we had some copays. All right, and I feel your pain. I hate this is happening. But keep this in mind, Cheryl. The most you'll spend out of pocket this year is $2,000 out of pocket on those meds. And so if you can't come up with that $2,000, then what I would suggest doing is seeing if you can't get some extra help from the government. They have an extra help program that's designed for people that have some income and asset issues, and you can qualify for that extra help program, possibly. I don't know where you are with income and assets, but then they actually will help offset some of your medication cost. Plus, that $2,000 max program that is out of pocket, you actually can enroll with your drug plan to participate in that. So they take that $2,000, they don't eliminate it. What they do is they spread that out over a 12-month period. So please contact them, Cheryl, because you really should not be broke in those instances. Now, it hurts. I understand that. But as far as being broke because the max out of pocket is $2,000 and it can be spread out throughout the year. All right, but I am sorry that it happened to you, but that is the way it's going to work this year. All right, let's keep going, Daniel. Okay, my wife is 53, collects SSDI. We have been married 25 years. I collect regular Social Security, and I've been since I was 65. My SS is far less than my wife's. Can I collect spousal benefits? Okay, so your wife is 53. Okay, Donna, I have never heard of someone getting spousal benefits off of disability. Okay, I'm not saying you can't. I think, and again, I do a lot of Social Security advising, a lot of work. So my point is, you're definitely eligible for spousal benefits since you've been married long enough, and she is taking. So that is a possibility. But again, that would be 50% of whatever she was eligible for at her own full retirement age, which is basically her SSDI benefit. And so whatever she's getting, you'd be eligible to up to 50% of that. Now, you took your own, it looks like, a little bit early, so there is going to be a penalty for doing that. And so if your full retirement age was 67, that's 2 years early, so you're going to lose actually about 18.5%. So what I would do, Don, is call the local Social Security office, make an appointment, and have them make a comparison between if you did get spousal off hers, how much that would be, less the penalty, of course, versus what you're getting on your own record. And they will give you the most that's available. So go ahead and make that call. And what they'll do is if the spousal is more, they will actually increase that. You're not going to get both. So what happens, let's just keep it simple. Let's say your spousal benefit's $1,500, you're getting $1,000 on your own. They'll continue to pay you your $1,000, and they will top up and make up the difference of that $500 up to the spousal. So it's not both really. The amount will be the same, but it's your own plus topped up to what the equivalent of that 50% spousal benefit would be. So call them, and they'll work through that formula to see what's the highest amount for you. Okay, let's keep going. All right, I used an SSA 40 to get my 25, IRMA removed. I just received one more time, only taxable income. Do I need to report that to Medicare? Okay. To get it removed, you just received more one-time only taxable income. Do I need to report that to Medicare? And the answer to that is yes, you do. Okay, so I think what I hear you saying is that you appealed your IRMA for 2025. You sent in the SSA 40 form, and it got approved. But those numbers that you gave to them are now different. Now, here's the thing. Carol, if you're single and you're still going to be below $106,000, even with this one-time taxable income, it's not going to matter. But if you're above 106 and they eliminated your IRMA, then I definitely would contact them and ask them how they want to treat that. Now, if you're married with filing a joint return, that number is $212,000. So again, if that one-time income is still going to keep you below the thresholds, I personally wouldn't be worried about it. Okay, but again, if it's pushing you above the thresholds, 106 as a single, 212 as a married person, then I would call my local Social Security office, tell them what happened. You had some additional income above what you had reported, and that's going to put you above those thresholds, and then they will make those proper adjustments. So I definitely would do that because they're going to go back and audit that. They may not audit it for 6 months or a year or 2 years, but you don't want to have that payment or that penalty that goes along with that. So reach out to them, and they'll help you correct that. All righty, Daniel, is there a standard list of Part A and Part B drugs that are covered by all plans, or do they vary by plan? Okay, William, first off, when it comes to Part A and Part B, those are medications that are professionally administered. Part A is hospital, skilled nursing facilities, hospice care. Part B is going to be your outpatient meds and chemotherapy, things like that. And so again, there's a different coverages, but the list is Medicare. So whatever meds the hospital is administering are going to be covered by Medicare A. And whatever meds are administered through the B system, which is going to be outpatient surgery, pain meds, those kind of things, chemotherapy, those issues are going to be covered through B. So if you have a specific question about a medication to be covered, what I would do, I would call that provider and find out. But as a general rule, anything being administered in either one of those settings, either inpatient or outpatient, is going to be covered by A and B, but there is no list out there that I'm aware of. And there's a list for Part D plans, the ones we self-administer, but not on A and B medications. All right, let's keep going. Okay, I will be 65 in November. When should I apply for Medicare? We'll just back up the clock, Linda. If November is your birth month, we go back October, September, August. So anytime after August 1, you can apply for Medicare. And Linda, we'd love to help you with that. We enroll people into Medicare A and B and Social Security all day long, every day. And so if you'd like us to assist with that, then we're happy to do so. For any of our clients, as we set up insurance, drug plans, advantage plans, supplemental plans, we will take care of the A and B enrollment for you. So you can call in, get an appointment for, again, anytime, what I say, October, September, so anytime after August the 1st, that enrollment can happen. I would, if I were you, set up a myssa.gov account. If you don't have one, myssa.gov. You'll just go to ssa.gov and set up an account, and it'll probably take you 10, 15 minutes. You'll go through the system called Login ID, and they'll set that up. You'll have an email address. You'll have login credentials that will allow us to help you with the enrollment after August 1. All right, let's keep going. Okay, in layman's terms, can you please explain the benefit of supplemental plan versus advantage plan? Okay, Denise. The benefits of a supplemental plan have to do with the way your insurance is going to work, how your insurance functions. And let me say this right out of the gate. There's only one item that supplemental plans and advantage plans have in common, only one. And that is, to have either one of those, you must be enrolled in Medicare A and B. Okay, for A, most people it's zero premium. For B, this year, most people pay $185 a month for Part B. Now, if you're high income, you'll pay more. Those additional surcharges is what the other guy was talking about, other question, and but that's above the thresholds. Single above 106, married above 212. Here's the point. If you have a SUP or you have an advantage, you have to be enrolled in A and B. Got to pay your B premium. All right. Now, beyond that, then those two systems are totally different. One is the government social insurance, Medicare. The other one is a private health insurance that has actually replaced the Medicare system for you. Again, we're still enrolled in A and B, but who is going to oversee, administer, and direct your health care? And so when it comes to supplemental plans, what's going on there is you're in original traditional Medicare, and you get kind of the benefits of that system, and I'll tell you what those are. Or if you're a private health insurance company, that's a different way your health care is administered. It's called a managed care plan, managed by a private health insurance company. So in layman's terms, to show you the differences, number one, with supplemental plans, you can go to any medical provider as long as they take Medicare. And that's 99% of all doctors, 100% of all hospitals. Advantage plans, you have to enroll into some kind of a network, either an HMO network or a PPO network. And probably the best network is going to have maybe half of all doctors covered in the network, and that's it. That's the best network. Some of them have about a third of all the doctors in their network. Okay, so you're not going to have unlimited choices for sure with advantage plans. Now, for some people, that's a big deal. Others don't. They don't care. Okay, but layman's terms, you have difference of providers available to you. Advantage, you have limited. Still could be lots, but it's limited. When it comes to SUPs, you can go anywhere that takes original Medicare. They will take your supplemental plan. Number two, there's an item within the healthcare business called a pre-authorization. Pre-authorization means that your doctor recommends, insurance company must approve and agree with the doctor before that service is covered and paid by the insurance company. So when you have original Medicare with supplemental plans, you never have a pre-authorization. Your insurance company can never have any intervention. They can't interfere. They can't delay. They can't deny coverage. If Medicare covers, they must cover. End of story. But with Advantage plans, you're going to have pre-authorizations about 70% of the time. And that means doctor recommends the Advantage plan must agree, approve, or you don't get that service. And many times they do agree and approve, but sometimes they don't. Sometimes they will say you don't need a knee replacement, you need therapy, or you don't need a full hip replacement, a rod is sufficient, or no, we're not going to cover that procedure, we don't agree with the doctor. And so basically you have given in that Advantage plan the final say-so of your healthcare services to the Advantage company. And again, they're gonna approve services, folks, but I've seen plenty of times when they don't, and it's very frustrating when that happens. All right, and the number three difference would be the length or the term of the policy. When you get a supplemental plan, it's approved and you have it for the rest of your life. You pay the premium and you're done. You never have to worry about that plan ever changing. The premiums can certainly change, and they will, but the coverage can never change. When you have an Advantage plan, right now they're good for 1 year at a time, and that's it. So those things change all the time. Sometimes they improve the plan, sometimes they decrease the plan, sometimes they pull the plan off the market, sometimes the company goes out of business, and that happens in the Advantage system on a regular basis. So it's very fluid because it's 1 year agreements. That's it. Supplemental plans are a lifetime. All right. Now, for a supplemental plan, you have all these little benefits of no networks, no pre-authorizations, permanent policies, but you got to pay a premium for those. And some people can't afford a premium for that. On the average, they're anywhere from $100 to $150 a month, sometimes more, but usually about $100 to $150, whether it's an N plan or a G plan. And so we pay a premium for that. When I get an Advantage plan, I don't pay a premium usually other than to Medicare. Those are usually zero premium because instead of paying a premium, I pay as I go. I go to the hospital, it costs me $400 a day. I get an MRI, costs me $300. I see a specialist, costs me $50. So the Advantage system is a pay-as-you-go system until you hit an annual max out of pocket. Supplemental plans, if you have a G plan, you pay a premium for that, and you pay a small deductible once a year, and then you're done. So again, it depends on what you're comfortable with. And I tell people that cannot afford a little extra, they can't afford that $100 to $150 a month, then don't try to. Let's find a good, wonderful Advantage plan for you. But if you can afford that little extra, I think the supplemental plan is wonderful in that if you ever get cancer or a serious health issue, you'll be grateful that you had it because now you don't deal with networks. Now you don't deal with pre-authorizations, nor do you have to worry about losing the policy. People with Advantage plans, if they don't want to pay a premium, then go with an Advantage plan. Many people take Advantage plans because Advantage plans are able to offer some additional perks, a dental allowance, maybe hearing aids, a gym membership, and all those things are really nice. But it really doesn't define the quality of the insurance that you get. They just throw these perks in. And again, I like them, but I'm not going to buy insurance, my health insurance, because they're going to allow me to go to the gym for free. That's a great benefit, but I'm more concerned about what happens if I get cancer. What doctors can I go to? If I had a serious heart issue, when am I going to spend max out of pocket for the year? So those are the features that you need to really look at when it comes to Advantage versus subs. Our company writes both because there's a place for both. But what happens is a lot of agents don't want to talk about supplemental plans because Advantage plans pay us a lot more. We get higher commissions. So agents want to push those because it's in the best interest of the agent for you to buy that. We get great commissions and we get lifetime renewals. But is it in your advantage, your best interest to do so? And so what we want to do is we want to pillow our head at night with a clear conscience, knowing that we tell you about both, and we can be unbiased about that, and we can be honest about that. There's ins and outs of both systems. The disadvantage to a supplemental plan, you got to afford the premium. Disadvantage to an Advantage plan is networks, pre-authorizations. They're not permanent policies. So both sides are going to have some issues. You just have to decide, once you have the right amount of information, what's going to be best for you. All right, let's keep going, Daniel. All right, question. Is there a dental plan company you would recommend for Medicare recipients? I'm on Plan G, thank you. Well, I think there's several. We write several. Here's what I would say. You want to find out what your dentist, if you have a dentist, what your dentist likes and takes. That's where I'd begin. Now, if you don't have a dentist, and that's another issue, then I'd find a plan, and then I'd find a dentist within that network. So it's just easier for you if the dentist will take the plan and file the claims and all that. So as far as names would go, We write a lot of Emeritus. There's a plan called Apex. Physicians Mutual has a good plan. There's just several of them out there. But it's not based upon what's the best plan. It's based upon your dentist. Do they take the plan? Will they take the plan? Are they in network? Are they out of network? With the plan, if they're in network, they'll normally file the claims for you. If they're out of network, you may have to pay cash, but then you get reimbursed. So I would look at that first. Then number two, what I would look at is what's the annual benefit of the plan? Is it $2,500 a year plus cleanings, or is it $5,000 a year? One of the things I get frustrated about with Advantage plans is many of them are only $1,000 a year. I don't even call that a dental plan. I call that a dental allowance. Now, some may be $1,500, but you may have to use a network dentist to get that. And so a true dental plan is going to be one that's going to give you a substantial annual benefit. The premium is going to be in the neighborhood of about maybe $50, $60 a month. And then they give you a couple cleanings as well. Meaning it is not just preventive, but it's also comprehensive coverage, extractions, fillings, root canals, crowns, those kinds of things. All right. So I'm not avoiding your question. I'm just saying to you, I have to know more who your dentist is, what kind of plan you're looking for before I can actually recommend a dental plan. So call us. So we'd be delighted to have you talk to one of our agents. They can tell you exactly what's available in your area. All right, Daniel, let's keep going. I'm recently diagnosed with cancer. I will go on Medicare the next month. Can I be denied coverage? No. Now, here's the thing. You're not going to be denied in the next 6 months of your B date. So you're going on Medicare next month. That's going to be the month of April. What I would do right now is call us, or at least work with someone that can show you what supplemental plans are in your market. Make a comparison. Look at initial premiums. Look at the G plan or the N plan. I think both of those would be very good options for you. But the point is, you want to get a plan now, and then you're still in that window after your B date starts in April for another 6 months. But the problem is, if you do that after this, your April date, now you're responsible for 20% coinsurance. You're responsible for the hospital deductible. And so what I would do is I would do something right now, and it's not too late. It really isn't. You may not have your supplemental card in hand come April 1. It's going to be close, but you'll at least be covered. And so give us a call. That 800 number there, in any state you're in, we can tell you the carriers in your market, and we can share initial premiums, stability of rates with those carriers, so you can make a good decision. So you're not too late. They have to accept you. After 6 months of your B date, they don't have to take you. All right, Daniel. All right, Brent. Here's the way it works. Just depends on where you live, sir. I'm sorry. So what happens in the majority of states right now when you get a supplemental plan, after 6 months of your B date, in order to switch supplemental plans, you have to go through underwriting. However, there are some states where there's some exceptions, and those states are called birthday rule states. So, Brent, I don't know where you live, but a birthday rule state allows anyone that actually owns a Medigap policy. This doesn't apply to getting a new one. It means you already own one. And the birthday rule state says around your birthday, could be 30 days before, 30 days after, could be 60 days after. There's always a window of time, usually 60 or 90 days of your birthday, where you can change carriers and sometimes even plans, but almost all of them carriers. And that means you're on a plan G, and around your birthday, you can move to another G, or you're on a G, maybe you can move to an N. Or you're on an N, you move to another N. So we can make these like to like or like to less plan switches. So you're changing companies to get a better premium, and you don't have to go through underwriting. Now, if we try to make this switch outside of the birthday dates, we can't do it without underwriting. But within that window, if you live in a birthday state, then yes, you can get one without underwriting. Now, let me just rattle off a couple of them that exist today, and there's a couple other states that are going to come on board in 2026. But right now, it is California, Oregon, Washington, the state of Nevada, Idaho, Oklahoma, Louisiana, Illinois, state of Missouri. It's not called birthday rule in Missouri. It's actually called anniversary of the policy effective date. Maryland and Kentucky. Those are the states, and again, there's a couple other states that are coming on with these rules. So depending upon where you live, and if you want to call in, Brent, we can kind of narrow that down to the state where you live and let you know for sure if it is a birthday rule state. Okay, but again, beyond the 6 months of your B date, if you're not in a birthday rule state, you would have to medically qualify. Okay, Daniel. All right, turned 65 February and have not applied for SSA. I'm healthy, take no medications. I get no income at the moment, so cannot afford to buy Part G for meds coverage. What are my options? Okay. Okay, so well, you said SSA. So are you talking about Social Security or Medicare? Daniel, you think he's talking about Medicare? Is that what we're dealing with here? So I'm not really sure. Have not applied. Okay, I'm healthy, take no meds, I got income. All right, so what I would do, here's what I would do. And I would do this really, really soon, Letitia. You are, for the next few days, are within what we call the GEP enrollment, GEP. That's a general enrollment period. Your initial enrollment period to start Medicare at 65 started in February 2024, ended March, April, May. So after June 1 of 2024, you are outside of your initial enrollment period. And so what I would do if I were you is I would very soon enroll into Medicare A and B, and you need to do this by the end of March this month. Here, just within less than 2 weeks now. And the reason for that is because you're not going to be penalized, because for every full 12 months we've not enrolled into Medicare B. Then they charge a 10% penalty for life, where you haven't got to that 12-month period yet. So go ahead and enroll in Medicare A and B. Now, because you're saying you have no income, what I would do then is I would apply for a Medicare savings program. And what if you qualify for income and assets, and sounds like you may, then the government will actually cover the cost of your Medicare B premium. And your state may also help as well. So that's what I'd be doing. I'd be applying for Medicare savings program. I'd be applying for extra help, but do get all this going before the end of the month. Otherwise, what's going to happen? You're stuck until next year at this time, because you can only enroll in your scenario the first quarter of the year. That's called the GEP. That's the first 3 months. And so if you get some extra help from the government, then they'll help offset those expenses. Then what you can do is then what I would do once I had A and B set up, I would enroll into a Medicare Advantage plan. You can't afford a supplemental plan, so get an Advantage plan, because at least then you'll be able to go to more doctors, and because you'll be given a network instead of just going to Medicaid doctors. All right, so that's what I would recommend doing. Okay, I hope that helps, and I wish you the best on that one. Okay, Daniel, let's keep going. Okay, our prescription like Zepbound and Ozempic covered by Medicare prescription portion. Okay, well, I don't know what Zepbound is, if it's similar to Ozempic. If Ozempic is prescribed for diabetes, then it would be covered. If someone's just taking it for weight loss, I don't think those are yet covered by Medicare. And by the way, I could be wrong about that, but I don't think so. I think they're looking at the possibility of some of these meds, having being covered for the purpose of weight loss within the Medicare system. But right now, Ozempic would be covered. But again, just if you have diabetes. And if someone knows something different about that, chime in on that. Let me know. But this Zepbound, I'm not sure of that. But I will tell you this: if you are taking, like the Ozempic and Zepbound is probably the same thing for its prescribed purpose, primarily like diabetes, then yes, it would be covered by all prescription drug plans. Okay. All right, I will be retiring at age 69, commencing July 1. I will need Medicare Part B only due to staffing shortage at Social Security. You recommend applying earlier than usual. Okay, July 1, yeah, it's fine. What happens, if you're going to start your Social Security, it looks like you must already be taking Social Security. You just want B only. Okay, so Kurt, let me tell you what's going on here. They do not want your paperwork any sooner than 90 days. So if you want July 1, let's back up the clock, June, May, April. So now anytime after April 1, you're going to have a form called an L564. L564 that needs to be dated after April 1. Your employer will actually complete the form. Now, Kurt, if you want to use our company, we'll do all this for you. We have to do an L564 and a CMS 40B, but they cannot be dated any sooner than April 1 because they want those forms filled out within 90 days prior to when you go effective. So if we're looking for a July 1 effective date, you're going to be able to start applying here within, right after April 1st. Now, as far as shortages go, you're not going to have to talk to anybody. So as long as you have A only, these two forms, L564 and the CMS40B, will bring you into the Medicare B system. So you don't have to have there's no don't talk to anybody. You can drop those off at a local office. You can mail them in or fax them in and do your enrollment really without anyone having to do anything. And then we can tell you exactly what to do, where to go, and make sure those forms are filled out properly. Okay, that's why you're going to do that. All right, if I have an employers, I think you mean supplemental to original Medicare insurance, and my insurance goes belly up, will I be eligible to sign up for Medigap without underwriting? I'm in California. Yes, you should be able to. Yeah, that would be, it's called an SEP, or a special enrollment period. And so if they did go out of business, then you'd be given a window of time. I've been in the business 16 years. I've never seen it happen yet. But I know that if it were to happen, they give you a window of time. I think it's 60 days from the date that policy was terminated because the company went out of business. Then every company in California that offers those supplemental plans would have to offer you a policy, no underwriting at all, no extra premium. And so that's the way that would handle. So the answer is yes. If that company went belly up, you do have an out. And that would be called a guaranteed issue right. Okay. Marvin, have you indicated you're waiting until you're 70 to start Social Security? Why then are you starting Medicare at 65? Okay, well, the reason I'm starting Medicare at 65 is because I'm self-employed. The company that you all have been dealing with, MedicareSchool.com, my son and I started that company. We actually have two partners as well. So we are self-employed. Now we have 90 employees and they're all covered by our company plan. But I am not. I'm just not. And so at 65, I am going to start Medicare. Anyway, so now as far as waiting to age 70, the reason I'm going to wait to age 70 is because Social Security, my wife has not paid in very much at all. And so even if I don't live to break even, let's say I don't live to be 85 years old, then delaying Social Security probably didn't help me, but it could really help her because the spousal benefit, the widow benefit, not spousal, survivor benefit is actually 100% of whatever I'm eligible for at 70 or whatever I'm taking if I die after that. So that survivor benefit can continue to grow, and that's why I'm going to delay to age 70. Okay, and so, yeah, I think our insurance plan right now, just so you all know, I used to be a pastor. I pastored for 20 years. It's been years ago. But my church put me on a healthcare co-op program. And so I've stayed on that. I have 7 children, and of course, some of them are older now, but it's worked out very well for us. It really has. But I am not staying on it once I'm Medicare eligible because our premiums have really gone up a lot. Not as much as group plans, but so they have gone up. And so I'm going on Medicare. I'll have to pay an IRMA for sure, but I'm excited to go on Medicare January. I'll be on a supplemental plan. Okay. Hope that helps. A little personal there, but you asked, so I told you. Let's keep going. All right. Do you have information on what to expect premium increase for each Medicare? Mm-mm. I do not. You said area which is community rated plan. Okay. No, I don't. I think those are going to be out soon because I think they start taking those increases sometime between April and June. I have not seen anything, at least across my desk yet, about what's going to happen in the state of Washington for in plans. I do know that there's certainly going to be some increases across the board. We think United Healthcare long term has been one of the very stable companies. There's others out there as well. Folks, we just have a lot of medical inflation going on right now. And that's what's causing these prices to go up. But no information yet. Sorry about that, Kevin. Alrighty, I have a friend who has an Advantage plan. She has had 3 hospital stays, 2 surgeries, and she says she has paid out no pocket costs. How is that possible? Okay, well, it is possible. I don't know what kind of plan she has. It would be possible for her to be 100% covered if she is also on Medicaid. Because for Medicare, Medicaid eligibility, those plans are called dual SNP plans. And I could see that happening in that scenario. Now, if she's not on Medicaid and she never has gotten a bill, it's only because the providers, the hospital, the doctor chose not to bill her. Because there are a few things on Advantage plans that have a 0 copay. But I can assure you a hospital stay does not. Most hospital stays right now are going to be between $300 to $400 a day, up to a certain limit, maybe 5 to 7 days. So there's no free hospital stays. Now, for someone on Medicaid with their dual SNP plans, dual eligible Medicare, Medicaid, that could happen for sure. They do have zero. So that's the only way, legitimately, it's zero. Otherwise, she just was not billed by the hospital, wasn't billed by the specialist or by the surgeon or whatever, which is bizarre. I've never, ever heard of that before, where they did not bill because the Medicare Advantage company paid the agreed upon rate, and then there was a balance that she's responsible for called a copay. And so if that provider chose not to bill her, hey, happy for her, but that is not the norm. Let's keep going. Okay, my employer accidentally contributed to my HSA after I had stopped in December. I'm planning to go on Medicare effectively July 1. Am I in trouble, or that will be okay if they reverse it? Yeah, they can definitely reverse that. Now, Susan, I'm planning to go on Medicare effective July 1, so that's coming up. So employer put in after it stopped in December. Okay, well, here's the thing. I don't know how old you are, but if you're turning 65 in July, you're fine to make contributions all the way through June. So that's no issue. Whoever put it in, whether you did or your employer did. But if you're saying to me that you're beyond 65 and they're going to backdate your A date, so once that A date's established, then true, no new money can go in once we have an A date. So if you stop at 65, if you're 65 in July, that's not an issue. But if you're beyond that, then that could be an issue. But again, they can reverse that, no problem at all. The government just does not want you to overfund your HSAs. So, yeah, you're fine. They can reverse it, truly. All right, let's keep going. Okay, isn't there a penalty if you do not take B at 65? No. Colleen, as long as you or your spouse are still working and you're covered by an employer-provided plan that has 20 employees on the payroll, not the insurance plan, don't care about that. It's the payroll size. So 20 people on the payroll or more, you don't have to do anything at all with Medicare, not A, not B, and you won't be penalized. Now, if you or your spouse are no longer working, yes, you need to take Medicare B at 65. You need to take it during that 7-month window. I would do it 3 months in advance of turning 65. But if you don't, you still have your birth month and 3 months after to enroll without penalty. That's a 7-month window called the initial enrollment period. But again, people that are in group plans, 20 or more on the payroll, you don't have to do A, you don't have to do B, won't be penalized. Only those that must start Medicare have to do it within that 7-month window. 3 months before you turn 65, month of, 3 months after. All right, Daniel. All right, Paul here, turns 65 tomorrow. Wondering if I sign up for Medicare and a Medigap now, how fast will I be covered under Medicare? Okay, so you're turning tomorrow. So that means you could have gone effective March the 1st. And so what's going to happen, your Medicare A will be dated for this month, 3/1/2025. Your Medicare B will go effective 4/1/2025. And if you sign up tomorrow, and by the way, we can do all this for you. Love to do it, Paul. Just call in, we'll help you. But you can start your Medigap policy 4/1. Now, there's actually one company that we actually could start it the very next day. Most companies start your Medigap policies on the 1st of the month. But if you want to have coverage, if you call tomorrow, we actually could start that policy effective on Friday, okay, which is going to be, the 21st. So you're fine, but I would get right on it. Call us, and we'll help you. Paul, we'd love to do so, sir. Let's keep going. All right, if on SEP in for physical therapy, it's going to cost you $20 for each day of PT, but on G, it's included. And that is correct. When you are on an in plan, which, by the way, is still a very good plan, you all. Okay, it's in plan's a fine plan. The in does say that you're subject to a copay of up to $20. Now, it could be $12. It could be $18. It could be $20. It'll never be $30. But up to $20 anytime that you see a provider. Okay, and so that you could be subject to that for sure. On the G plan, the only out-of-pocket you have would be the Medicare B deductible, which is once a year. So you got to pay the first $257 for anything on the B of Medicare, the first $257 once a year, and you're done. And then that B deductible resets every January. And so that's the difference between the G and the N. The G covers everything but the B deductible. N covers everything but the B deductible and excess charges. if and when they would occur. Pretty rare, but if so, N doesn't cover excess, and then N has two copays: $20 for a doc and $50 to go to the emergency room. That's the difference. So you just have to decide basically what's the premium difference between G and N. Most states is about $40 a month. Some states more, but decide between those two. And honestly, folks, they're both good options. They just are, depending on where your budget is, where you want to be, and if you're comfortable with just a little extra risk on the N versus the G. Okay. Okay, Patty, listen. Into exactly what you need to do. Okay, you have COBRA until September. You're turning 65 this month. Listen, you need to enroll in a Medicare A and B immediately. Immediately. Okay, now your A is going to be 3/1/2025. Your B is going to be 4/1/2025. Okay, but here's your problem, Patty. Right now, as I sit here and talk to you right now today, if you had a medical claim, that COBRA policy is only going to pay second. You are absolutely 100% responsible now for anything that Medicare would pay. You now have to pay. Okay, you are not in a good position, Patty. I have seen cases personally. I've seen people that in your position had a serious health issue, had COBRA only, didn't realize they were supposed to be on Medicare, and it cost them $80,000. And no exaggeration, I've heard of cases worse than that. So please, immediately, you want to go and enroll in A and B. And Patty, call us now and talk to our agent. We can make this happen for you. And then what you can look at is then decide, do you want an Advantage plan with your A and B, or do you want a supplemental plan? And again, there just depends on what your budget is going to be. And that supplemental plan, again, can start either tomorrow or can start 4/1 at the very latest, depending upon your carrier. Okay, but here's the thing. I'm not telling you that you need a supplemental plan right now. What I'd want to know first, and you tell our agent, what is that COBRA coverage costing you? Is it costing you more than the cost of a med sup? Or if your company's providing it for you at no cost, what you want to do then, you keep that COBRA through September, and then you can start your Medicare supplemental plan in October, because your Part B date is going to be 4/1. So we got 6 months, 4, 5, 6, 7, 8, 9. Okay, so then you would want to start that supplemental plan either 9/1 or 10/1. So you're really in a fine position, other than your issue right now is you've got to get enrolled in A and B because you want them to be the first payer and not you. And then you have a little bit of time to decide what you want to do beyond that. And again, we'd have to know, what does it cost you out of pocket for that COBRA premium? If your company's covering it all, then let's push it out for a few months before we start your supplemental plan. But if they're not, then we'll just make a comparison. But we can help you with that. It's not panic time, but you got to get moving for sure. All right, Daniel. I turned 65 in August. I have colon cancer that metastasized to my liver, and I'm sorry to hear that. Wow. What are the best plans for me? Okay, Bruno. If I were in your position, as long as you can afford to get a supplemental plan, what I would do is I would get a G plan. You get enrolled in Medicare A and B. They will start that August, and then you'll get I get a supplemental plan G. As long as you can afford the premium. If you can't, then get a supplemental plan N. But you do not want to, in my opinion, be going through cancer with an Advantage plan. Not that they're bad, but you're going to have network issues, pre-authorization issues. The plans can change on an annual basis. Max out of pocket could be anywhere from $5,000 to $10,000 a year. Where if you take a good supplemental plan G or N, you can count on what it's going to cost you. Those are very predictable costs. With the Advantage plan, it's pay as you go, and you can max out. I've seen people have to max out twice within a matter of a few months because their cancer treatment carried over from one year to the next. So get a supplemental plan G or N and call us, and we'll actually help you to look at the different rates and different carriers that are in your area. Okay, that would go into effect August, and this is the perfect time to do it. Back at the clock, June. Yeah, you're ready to go. We can help you right now. Okay. Phil, can you comment on Part D penalties? Does enrollment fall to Part B SEP 6-month window, or must be enrolled in Part D sooner? Okay, very good. So let me, first off, when you're talking about Part B SEP 6-month, here's the way it works. If I'm going to get a Part D plan, and I'm going on Medicare A and B at 65, I still have that same window to get a drug plan. So let's say we're starting at 65, and my birthday's in April. I could put off a D plan, I could enroll, I could skip May, June, I could enroll as late as July. So I'm saying my birth month is April. I could enroll in a D plan as late as July. That's the 7th month of my IEP. And that plan would start August 1. I would not be penalized. Okay. Now, if I'm going to keep working past 65, I'm going to pick up a drug plan, let's say when I'm 67. Once that drug plan ends at work, I have 63 days to enroll into a drug plan without any kind of penalties. Okay, and so when you say 6-month window, that 6-month window I have been referring to during this, this particular program has been 6 months tied to the Medicare B date, and that has to do with supplemental plans. That's different than drug plans. So drug plans at 65, I must enroll during my 7-month window or after 65 within 63 days of losing the plan. So if I don't enroll during those times, what happens? There's 2 types of penalties. Number 1, you can't get a plan just because you want one. You have to wait until the Medicare's next open enrollment season, which is October 15th to December 7th. Okay, and then the new plan won't start until January 1. So let's say right now someone didn't have a drug plan because they were healthy and they just got diagnosed with cancer and now they need some self-administered medications. They cannot get a plan right now. They can add it later this year, October 15th to December 7th, but that plan's not going into effect until January 1. So that's why I tell people, get a drug plan. There's plans out there that are 0 premium. There's some that are $3, $5. I mean, you can get good drug plans for less than $20 a month. So don't take the risk of being without a drug plan. I don't care how healthy you are today. I've had plenty of people that are healthy right now and 3 months later diagnosed with cancer, 6 months later, they died. Okay, and I've seen that in my career. So you have no idea what the future holds. I'm glad you don't take any meds. I don't take any meds, but I guarantee I'm going to get a drug plan. I'm going to get a low-cost one because I can always change that plan on an annual basis, but get a drug plan. The penalties then are being without drug plan if you need one. And number 2, for every month we go without a drug plan when we should have had one, we have a 1% penalty. And so that's not much. It's like 35 cents a month. So if you go without a whole year without a drug plan, that's $4.20 penalty added to drug plans later, and you pay that for life. So they're lifetime penalties. So get a drug plan for sure. It's crazy not to get one. It really is. I mean that. Okay, keep going. All right, if the doctor accepts Medicare, do they have to accept my supplemental plan? Absolutely. Or must I find doctors who do? No. Ted, the way it works, 99% of non-pediatric doctors accept original Medicare. 99% of them. 100% of all hospital they do. So as long as that provider, hospital, doctor, specialist, surgeon, whoever, takes original Medicare, they're required to take your supplemental plan. You don't even have to ask them. If they take traditional Medicare, they will take it. They have to take your supplemental plan. It's just the secondary payer. You have the right to choose anyone that you want. Now, I will tell you this, occasionally, and I mean very rare, we'll have doctor groups, primary care docs, that all they take is Advantage plans. Why is that? Because the Advantage insurance company owns them. That's why. And that's all they'll take. And it doesn't happen very often. I've seen it before, but that's not the norm, but it does happen. But 99% of all doctors will take your supplemental plan. All right, let's keep going. All right, so here's what happens. It was canceled for non-payment of premium. And so what happens when he didn't pay his premium, the insurance company gives him 30 days of grace. I've seen some give 45 days of grace. So that's the first thing. Let's see if I'd call immediately and find out if he's for sure been canceled and he's beyond his grace period. Okay, so if he has been canceled, then let's find out his health conditions, because we can always see if we can get him through underwriting, and that's the next step. But if his health is real bad, then he may be in a mess. Now he can add an Advantage plan, folks. Let me stop here. Listen, in my opinion, the least worst option is A and B only. Next best, Advantage plans. Best would be supplemental plans. And so in his scenario, if he can't qualify to get a supplemental plan now, or because he's beyond his grace period, if he has bad health, then an Advantage plan is a lot better than having A and B only. All right, but he cannot add Advantage plan right now. It's impossible. He can add one later this year, October 15th to December 7th for a January 1 start date. But the first thing I would do is try to get that insurance company to reinstate it. He'll have to, of course, immediately bring it current. So hopefully they'll do that. If not, then let's see if we can't get him through underwriting. And all companies are different. We'll have one company that wouldn't take depression medications, another one will. We'll have some that if you have AFib, they deny you. We have others that if you have AFib, as long as there's no meds involved, they'll accept you. So there's a lot of different companies out there. So we looked at the health conditions to see if we can't find a good match and get some company to approve him. Okay, and we'd be happy to help. Give us a call. We'll tell you what to do. Okay, DocSoft says they don't accept my plan in. Insurance company says it doesn't matter. The Medicare will bill my insurance company without the doctor office referencing my... Okay, first off, the reason, Ken, that they're saying that they're not going to accept your plan in is because you're dealing with someone in a billing department or a receptionist that doesn't know what they're talking about. That's totally ridiculous. It just is. Now it is true in that if they file the claim, Medicare knows you have the plan in. And so what Medicare is going to do is they're going to take the balance of that bill and they're going to send it directly to your supplemental company. Now, if you haven't met your B deductible, you're eventually going to get a bill from the provider, but just the B deductible and just your co-payments, that $20 on the end plan. All right. So it is true. But again, that's sad. Your billing department, they're clueless. They should include that information when they make that Medicare claim and let them know that you're with, whoever you're with, Aetna or HCHUB or United Healthcare, Mutual of Omaha, whoever you're with. They ought to include that information for sure. But Medicare does know, okay, because that insurance company would have notified them that you have this supplemental plan. So just sad. Now, because a lot of people that work receptionists in these offices or billing departments, that are rookies, they don't know the difference between Advantage plans and supplemental plans. Yes, Advantage, they don't have to take, but supplemental plans, they have to. All right, let's keep going. Okay, I'm 63 this year. My spouse is 61. Should we set up an appointment with your team or wait a year or two? Yeah, Joe. Unless either one of you are on disability, which probably not, but if you're on Social Security disability, then you would start your Medicare within 2 years of starting Social Security disability. But if you're not, there's no way to come into Medicare this early at all. So really the best window, Joe, is about 6 months before the 65th birth month. So you're 63, so is within 6 months of turning 65, then that's when you want to talk with us. Now, remember this, Joe, if you are on Social Security, you'll be automatically enrolled into Medicare A and B, and the Medicare card will show up 100 days prior to your birth month. So those that are on Social Security are auto-enrolled. If you're not, then you have to make that enrollment happen, okay? And we, of course, would help you with that. But it's just too early. But keep learning. And go to our website. And I've got an Essentials workshop. It's 50 minutes long and really very full of great information. Our YouTube channel as well. So just continue to avail yourself of resources and get as much knowledge as you can so that you're ready when the time gets closer. All right, let's keep going. How far in advance can you apply for Social Security for your normal retirement benefit? Okay, so when you say normal retirement, I think you're saying your full retirement age, normal retirement age. So the answer to that question, Denny, is 4 months. 4 months. So I don't know when you're going to hit your full retirement age, but just back up the clock 4 months prior, and then you can enroll into Social Security. Medicare is 3 months in advance of your birth month, and Social Security is 4 months. All right. Who else? All right. What are people talking about when they say there's a penalty for the rest of your life if you don't sign up? Okay. Well, what they're talking about is that there's 2 penalties in Medicare, that are lifetime, and that is Medicare B and Medicare D. That'd be drug plans. And so Medicare B is the outpatient side of Medicare. Now, Annette, if you have worked for at least 10 years paying into the Medicare tax system, 10 years, that's called 40 quarters. We get 4 quarters a year. If you paid into that system, you will never be penalized on Medicare A. Okay, so that's very rare that people don't have 40 quarters. If you don't have your own, you can get them from a spouse or an ex-spouse. Okay, so with A, there's rarely a penalty. But B is the one that you'd have a penalty if you should start Medicare at 65 and you don't, then you can be penalized on Medicare B. And here's the penalty. For every full 12 months that you did not go on Medicare B when you should have been enrolled, for every 12 months, they charge you a 10% penalty added to your Part B premium for life. So if someone goes without for 2 full years, they're going to have a 20% penalty added to Part B, and they pay that for life. Drug plans, those penalties are basically 12% a year. And they take that 12% penalty and they add that to your drug plan premium. And again, you paid that for life. And so Annette, if you or your spouse are no longer working, where you don't have an employer option, then you want to start Medicare at 65 and you won't be penalized. If you're still working, you or your spouse, and you're covered by a large group, 20 employees on the payroll or more, you can delay A and you can delay B as well. As long as you keep being covered by an employer plan, yours or your spouse's, then you never have to worry about penalty. Once you get ready to retire, then we can enroll you into Medicare, no penalties, no problem. So not everyone, in fact, not everyone has penalties. But you have penalties if you don't come into Medicare at the right time, and that really depends upon your work situation. But if you'll call our office, we'll walk you through those different details and tell you exactly what to do. And then if you go to our website, MedicareSchool.com, I have an essentials workshop. It's 50 minutes long. You'll learn so much. I would encourage you to go there and watch that workshop, please. It'd be very, very helpful for you. Okay, Daniel, let's keep going. I'm a retired federal employee at FHB. Would I still need to purchase Advantage or supplemental plan? Lisa, not necessarily. I don't know if you have GEHA or you have a Blue Cross Blue Shield. That's the most common today. If you have FEHB benefits, I would, if I were you, at least get A and B. I'd take A and B and then look at your FEHB. And I'd like to know what the premium is. Because some of the federal plans have very reasonable premiums and some are kind of high. And so if you have a reasonable premium, you can have A and B and FEHB. FEHB also includes a drug plan that's credible, so you can do that. Or what a lot of federal employees are doing is they're doing they enroll in A and B, and they do a Medicare Advantage only plan, and your FEHB will coordinate with that Advantage plan, and then you can take advantage of some of the perks, and also by enrolling in A and B. If you have FedBlue or GEHA, they'll give you about an $800 a year credit towards your Medicare B premium. So that's a good option. So you really have several different ways in which you can go. The only negative, Lisa, with doing a supplemental plan in your scenario is you would have to actually terminate your FEHB. If you take Advantage, you can suspend. But if you take supplemental plan, you're going to terminate that. And so when you terminate it, you can't get back in. So you want to think long and hard about that one. I've seen lots of people do it in my career. They didn't care to be in, GEHA or FedBlue, just wasn't advantageous for them. And they just did what millions of others do. They just take supplemental plans. But again, you got to fill out a form to get that premium drop from your annuity payment. And you have to terminate FEHB. So those are your options. There's several of them. And again, our agents could walk you through each one of those to see really what's in your best interest. All right, let's keep going. Okay, Todd, I'm retired military, still have a few years to go before I need to make these decisions. Is TRICARE for Life a network with only certain doctors, or should I look at GRN? No, TRICARE for Life, of course, will move to the second payer position. So you would have A and B, and then TRICARE is going to serve as the secondary payer. And so in that scenario, Todd, I wouldn't get a supplemental plan if I were you. I just wouldn't, because I just feel like you're overinsured. I love supplemental plans, but not with TRICARE. TRICARE is going to pay second. The thing that I think you got to deal with on TRICARE is right now I think they have a max out of pocket of $3,000. And again, that's not immediate. That's just through copays and different things. But I wouldn't get a GRN if I were you. I would do A and B and then get your TRICARE. And then what a lot of retired military people are doing today is they're enrolling in what we call MA only plans, Medicare Advantage only. Because TRICARE will coordinate, just like my last question, they'll coordinate with the Advantage plan. So TRICARE will coordinate with A and B, or TRICARE will coordinate with the Advantage plan. And so what happens is the Advantage plan, if they're coordinating, they'll pay first, TRICARE pays second, and they'll basically pick up all the expenses that Advantage plan did not. So that's really nice. And then you can get some dental allowance and hearing aids and the gym membership and all those kind of perks that the Advantage plan gives you. You'll still get your meds through TRICARE. And when you do that, then what happens, that Advantage plan will actually give you a credit back towards your Medicare Part B. And that's $150 sometimes, $175 a month. And so that's a very, very attractive package. So the point is, we'd enroll at A and B, you'd enroll into Advantage plan, and then TRICARE would coordinate with the Advantage plan. So you'd pay very little for your Part B and nothing for your Advantage plan. So that's a good option. And the beauty of that option is, Todd, it's not forever. If you decide you want to just return to TRICARE only with A and B, you can do that any year during Medicare's open enrollment period. So it's not a permanent decision. All right, so I kind of like that. All right, let's keep going. I thought spousal was changed to only folks eligible prior to 1/1/2020. No, no. What happened for the 1/1/2020 date had to do with the supplemental plans C and F, and so what they did is anyone that started Medicare prior to 1/1/2020, it could be spousal Medicare is fine, but you had to have a Medicare dates prior to 1/1/2020. You could buy any of the supplemental plans on the market. But anyone starting Medicare after 1/1/2020, they could not get F or C. They could only get the G and the N plan and some of the others. So there's 10 supplemental plans. 10 of those are available for anyone starting Medicare before 1/1/2020, but only 8 of them are available if starting Medicare after 1/1/2020. So C and F were eliminated from their options. That's what that means. Okay, so let's keep going. I'm ready. Okay, well, first off, Jim, there's several that are looking at it saying, what is he talking about? Let me explain a little bit first about this. First off, all Medicare plans are regulated by the state insurance commissioners. And some are highly regulated, others give the insurance companies some options. And so one of the options for establishing prices in a state, the premiums for that state, they have 3 different pricing methods. And this pricing method has to do with the initial premiums that are established by the supplemental companies and how price increases occur. And so he, in his question here, is asking about those 3: community rated versus issue age versus attained age. So the community rating means that everybody that's in that area, that community could be a whole state, it could be half of a state, but it's a region, and everybody that is going to get a MedSup plan around that same period of time pays the same price, regardless of gender, regardless of age, regardless of health conditions. Everyone gets the same price. So that means that the 65-year-old pays the same amount of premium as the 85 would. Okay, so what happens? Well, that's going to be your highest initial pricing for sure, because everyone pays the same amount. So those insurance companies have to kind of average that out. So that's community. Now, all of these methods go up. They all go up by having group increases. And group increases occur, and here's the way it works. It's very simple, folks. When someone has a supplemental plan, they're going into a group. And that group could have, a few hundred, it could have several thousand. But money goes in through premiums and money goes out through claims paid by the insurance company. And so when there's a group increase, it means that more money went out in claims than money that was coming in premiums. And so whenever that happens, the insurance company is losing money. They have the right to raise the rates after the state insurance commissioner has approved of that rate increase. So all these methods go up with group increases. Again, more money goes out in claims and money come in through premiums. That happens. So that's community rated. They start off the highest and they can go up only with the whole group. Issue age means that, and by the way, there's a handful of community states, there's a handful of issue age. Issue age means that when you get a policy, you're going to pay a premium based upon your age when you first get that policy, which means what? The 65-year-old pays less than the 70-year-old. Okay? The 68-year-old is going to pay more than the 65-year-old. So the age matters with the issue age policy. But future price increases, again, can only be a group increase. So the only way they can go up after that initial premium difference would be whole group goes up. Again, why? Insurance companies losing money, more goes out than's coming in. They have the right to petition for a rate increase. The third one's called attained age. Now, attained age starts the lowest and frankly could even be the lowest long term. But what happens with these, they start the lowest, and then every year that you have a policy anniversary, you're a year older, that rate's going to go up a little bit. You've attained another age. You're 65, now you're 66. Rate's going to go up a little bit, maybe $50 for the whole year divided by 12, $3 or $4 a month. So little by little by little, that creeps up because of the policy type, attained age. You've attained another age, they're going to raise the rate for you. Okay, and so attained age starts the lowest, issue age kind of mid, community is going to be higher. But remember, they all go up because of group increases, all of them. Okay, none of them are guaranteed to be stable than another. What matters is how many people are in the group. Now, personally, I would much rather be in an attained age group because I'm going to start lower, and those little slight increases really are for the purpose of making sure I don't have some drastic price increase. So insurance company moves it up a little bit every year, so I don't have a drastic price increase. I've seen drastic price increases from community for issue age and attained age. I've seen it all. Okay, so when someone says issue is going to be for sure better, that is not true. The reason they're saying that is because that's what they sell. Okay, what really matters is how big is the group, and that's just the truth. And so you're saying what is the best? It just depends on how big is that group. I would much rather be in an attained age group that has 25,000 policyholders than in an issue age group that has 1,000, okay? Because that issue does not have enough people in the group to spread the risk out in case there's cancer going on within the group. All right, so that's my 2 cents. That's a weedy question, so I thought I'd at least clarify some of the details there. Let's keep going. All right, if you continue to work after age 65 because you have group coverage, do I have to wait to retire to go on Plan B, or can I enroll anytime? Yeah, you do not have to wait. You have the right after 65 to go on any time that you want. Okay, now, I would say this. If you do continue to work and you are covered by a large employer, remember something. Even if you take B, it's still going to be in the second payer position. Your group plan is going to pay first. So if you have a good group plan, I would not take B. I would you take A only. If you don't have an HSA, take A only. If you have an HSA, do nothing. Okay, but don't take B if you have a good group plan. That's a total waste of money. So what I would do is compare. Is your group plan financially better than what your Medicare option would be? If your Medicare option is better, then I would drop the group plan and just go on Medicare. Your employer will let you do that. They have to at 65. And if you want some help making that comparison, Leah will help you with that. Just call in, and our agent will walk you through that process to make sure you're gathering the right amount of information to make that decision. Give us a call. We'll help you. All right, Danny, who's next? Okay, this is a broad range question. In general, which state has higher supplemental rates, North Carolina or South Carolina? Thanks for these great videos in your live streams. Okay, well, I would say, I'd say probably South Carolina, maybe a little bit lower, but not drastically. Usually when we look at regions, now if you would have said what's higher, Vermont versus North Carolina, I know the answer would have been North Carolina would have been lower for sure. So it's more a region of the country. For instance, in the Midwest where I live, here, Missouri rates are a little bit higher than Kansas. We're side-by-side states, but there's different laws for Medicare supplemental plans in these states. Around our area, Illinois is a very attractive med-sup market, very comparable to Indiana, very comparable to Kentucky. Arkansas, probably a little bit lower. So my point is, it really depends on the part of the country that you're in as far as a big difference. Florida is going to be higher for sure than North and South Carolina. New York's going to be higher. California is going to be higher. State of Washington, higher. So between those two states, not a big difference. Now, there could be a difference in carriers. You may have, one carrier at X amount, another carrier $30 or $40 higher. That could vary, but those two states, because they're side by side, probably very similar. All right, let's keep going. Thanks for the encouragement too, by the way. Appreciate you watching the videos and learning through our channel. I have WellCare. When I filled out the form, I only took one med. If I got a medical problem that requires more expensive meds, will they pay? Yeah, the WellCare plan that you're probably on, that zero premium called WellCare Value Script, it is a good plan. There are good, better, best drug plans, and that just simply means size of formulary. And so the formulary that you're on right now probably has, maybe 2,000 meds, maybe 2,500. And so more than likely, if you were to get on another med, it's probably going to be in the formulary. But if it's not, you can always ask for an exception and ask them to add that medication to, for your drug protocol for that year. It's called the formulary exception. And they're almost always approved. So I wouldn't worry about that if that's your situation. And then what I would do, if it's not in formulary, but they add it for 2025, then I'd definitely be changing that drug plan for 2026, because every year you can change your drug plan. All right? And so it should be fine. Most of those plans are going to cover your meds. Now, if you're on something real expensive that they may not cover it, then you want to ask for the formulary exception and then switch that plan later this year. All right. Okay, live in New Jersey, enrolled in A, B, and D. Plan G, I may be moving to North Carolina by the end of the year. I will have to reapply for my supplement plan No, not at all. Not at all. That G plan that you're on, you're going to take that with you to North Carolina. And the carrier does have the right to re-rate that, and sometimes they re-rate that down. Rates could be lower in North Carolina, and probably are, than New Jersey. That doesn't mean they have to necessarily lower, but I'm saying to you, trust me, that supplemental plan is yours for life. They are not going to cancel that because you relocate. I'd like to know what they're going to re-rate you at to see where that premium is going to be. If it's still attractive, then I'd stay with it. Now, if you're healthy, and there's another carrier in North Carolina that is a better rate, then you can always reapply. Again, you would never get rid of your New Jersey policy until you got approved with another company. So typically when we have people that are moving like that, we want to find out their health condition. If it's terrible, then you're going to have the same plan you had in New Jersey in North Carolina, subject to being re-rated. But if you can qualify, then you may want to switch carriers. All right, but you have the plan for sure. They cannot cancel it because of relocation. Only non-payment of premium. All right, who's next? Okay, went on Social Security and Medicare at 65. What is the income limit to earn without penalty, and is there always going to be a limit in future years? Okay, here's the way it works. For those of you that don't know what this person is talking about, they're talking about the earnings test. And so what happens from 62 up until December of the year before you hit full retirement age? Okay, let me say it this way. Let's say that I'm going to hit my full retirement age this month. What would have happened from the point of 62 up until December of last year, I'm in a range where I cannot make very much money. Right now, that's $23,400, $23,400. Okay, that's called the earnings test. And by the way, listen, this is just wages that they're testing. No rental income, investment income, annuities, pensions, none of that's tested, just working wages. So from 62 up until December of 2025, in my example, I could have only made $23,400 a year. For every $2 I make above that, they take $1 out of my Social Security check. And that dollar penalty, they calculate for the whole year, and they front load that. So let's say I'm making $2,000 a month and my penalty is $4,000 for the year. They'll withhold 2 months of Social Security checks, and then they turn on my Social Security. Now what happens though, that low earnings test amount changes the year I turn full retirement age. So back to my example. Let's say I'm turning full retirement age April 2025. That means that for all of January, February, March, I'm not yet full retirement age, but I'm turning this year. So the year I turn, this year I can make $62,160. And I can make that in that 3-month window. It's an annual amount, but they don't prorate it. So you can make $62,160. For every $3 I make above that, they take out $1. Okay, so what I'm trying to teach you is there's a low amount, and there's a high amount, and then there's no amount. Once you hit your full retirement age, month and year, then there is no longer an earnings test. It goes away. And that's why many people wait until full retirement age. They don't have to take a reduced benefit, and they can keep working and draw their full income at work and draw their full Social Security. And that happens at the month and year you turn full retirement age. So low amount, higher amount, and then no amount. That's the way it works. All right, let's keep going. Well, what if you can't afford supplemental? This all adds up. Yeah. Well, Nancy, if you cannot afford a supplemental plan, then what I would do is get the very, very best Advantage plan you can, meaning let's make sure all your doctors are in the network offered by the Advantage plan. Let's make sure you're comfortable with the co-payments that go along with that. Look at the aspects of how to use the perks that they throw in. So again, just take some time and we'd be delighted to help you with this. And let's go through and find the best Advantage plan we can for your particular situation. That's what I would do. If you cannot afford a supplemental plan, don't attempt it because you won't keep it. And there's no reason to do that at all. All right, let's keep going. Okay, what is your office number, please? It should be right there on the screen. There you go. That's our toll-free number, and the office is still open for another 30 minutes, 7 to 7 Central Time, Monday to Thursday, 7 to 6 on Friday. So tomorrow we're 7 to 7 again. Just call in, and you can get on our calendar, and we'll help you. Be delighted to serve as your broker, our privilege. Let's keep going. Okay, hi, I have an appointment with Jonathan on April 2nd. Okay, Jonathan is a very talented young man, great agent of ours, by the way. I'll be turning 65 on July 13th. Getting on MA only. I'm retired military. Good. Does Jonathan set all this up? Absolutely. Yes. Yeah, he'll help you also, Albert, with your A and B if you haven't done that already. We'll do it. and then there will be whatever MA plans that are available for you, which are great, great plans. He'll walk you through that. We'll find out what your Part B reduction will be on that MA plan. So no, we'll do it all. Retire military. So you'll have what you'll have is you'll enroll in A and B, and then TRICARE will then coordinate with your MA only plan. You'll still use your TRICARE for your medications. That's how you get that Part B reduction. But it's a very, very good way to go. And he can do it for you. All right, next. If for some reason laid off this coming school year, how fast can I be on Medicare? I will not have health after, I believe, 1 month. Okay, Kathleen, you're not in any kind of a problem whatsoever, okay? If you called tomorrow and said, hey, I need to start my Medicare April 1, we can make that happen for sure, I promise you. In fact, as long as the last day of the month is a business day, we can even do it the last day of the month. I hate to do that. I've done it before, but we can. Now, understand something, Kathleen. You're not going to have your Medicare card in hand or your insurance card in hand, but it won't matter. You'll be covered. So if I were to submit somebody on the 31st, I don't know if 31st is a business day, but if it is, and I submitted on the 31st, we would request an effective date of 4/1. You absolutely will have coverage 4/1 of 2025. Okay, yeah. So just let us know, and we'll make sure that's all done very, very quickly for you. Okay, keep going. Okay, very good. I guess that's it for now. Okay, folks, hey, we want to thank you for watching. Next week, next Monday night, I have an event that we call Medicare Monday, where we'll look at a topic and kind of dive into a little bit deeper than what we've done tonight. But if you can, let us help you, and also tell others about us. We'd be grateful for you to send people to our channel, or to our Facebook group, and just learn and use the resources of MedicareSchool.com. Thanks so much for watching. Have a great evening.